Knock, knock, I'm coming in. As I'm walking in, I'm gonna sanitize my hands for 20 seconds, starting now. Okay. Hello, my name is Radley. I'm going to be your nurse today. So what I'm going to be doing today is I'm going to be doing some tracheostomy care. But before we get started, I would like to establish a means of communication, okay? First off, thumbs up means yes, thumbs down means no. And if you are in any pain, do not hesitate to raise both hands up, okay? All right, so I'm just going to verify your name and date of birth. Is your name Daniel Jones, and is your birthday 12/12/2000? Yeah? Okay. And is it okay if I call you Mr. Jones? Okay. All right, Mr. Jones, do you have any allergies? No? Any sensitivities? No? And have you done this procedure before? Yeah? Do you have any questions or concerns before we get started? No? Okay. So I'm just going to take a look at your vitals. I do see that all your vitals are stable. And I do see your respiration rate is at 16, and your O2 set is a little low though, at 92%. And I do see that there is no evidence of increased work of breathing. And I'm just going to take a listen to your lungs, okay? All right. I'm going to wash my hands for 20 seconds. And then grab my stethoscope. Breath in, breath in, breath in, breath in. Another breath. One more. All right, looks like there is evidence of secretions in your lungs, so it looks like I'm going to be doing some suctioning today, okay? So, all right, Mr. Jones, I'm going to be preparing the supplies now, okay? 20 seconds. All right. All right, it's been 30 seconds, so now I'm just gonna wait for the table to dry for 2 minutes. Wash my hands for 20 seconds. In the meantime, I'm gonna be looking at my emergency supplies. I do see that I have an empty bag connected to 100% oxygen. I also do see that I have a suction catheter that's connected to the suction canister. And then I do see that I have two trach tubes, one that's of current size being a size 6, and the other that's a smaller one being a size 4. And I also do see that I have an inner cannula. So it looks like I have all my emergency supplies ready to go. And then now I'm just gonna close the drapes and the door for privacy. And then I'm gonna raise my patient to hypothalamic position. All right, Mr. Jones, I'm just gonna be raising your bed, okay? All right. Okay. 2 minutes is now up, so it looks like I am going to be putting my supplies onto the table now. Wash my hands for 20 seconds. Just gonna throw this away, wash my hands for 20 seconds. Okay, so I'm going to put my gloves, got my hand sanitizer, got my tray and my inner cannula, have my saline bottle, and then my suction catheter and trach stabilizers. Okay, just going to open up the tray, got my sterile gloves I don't need, throw that in the trash, and I'm going to make sure I'm going to grab the edges of the 1-inch border sterile drape. Gonna put that on the patient. shiny side down. Okay, looks good. And then now I'm going to drop the inner cannula. Okay, dump that in the trash. And then now I'm going to be preparing my saline solution. Just going to take out the box, leaving the suction catheter in there. Okay, I'm going to fill it up halfway. Pour some in the trach tray. Okay, I'm going to be replacing the old suction catheter. Okay, throw that in the trash. I'm going to be grabbing my new suction catheter. Throw that in the trash. Putting that on. And now I'm going to be adjusting the settings. I'm going to put my suction catheter to 120 millimeters of mercury. And then I'm also going to be testing my ambu-bag to make sure it works. Okay, it works. And then now I'm going to be hyperoxygenating the patient now. Okay. All right, Mr. Jones, I'm going to be hyperoxygenating you, okay? Your O2 stat's a little low, so we're going to have to do that. So, take off your oxygen collar. All right, Mr. Jones, 3 breaths, okay? Ready? 1, 1, 2, 3, 4, 5, 6, 2, 1, 2, 3, 4, 5, 6, 3. Right. Your oxygen saturation is now at 98%, so it's okay to proceed with doing the suctioning. Okay. Alright, so now I'm just going to test to make sure my suction catheter works. Exposing 4 inches. Okay, it works. See that my suction catheter jumped up to 180, so I'm going to turn it back down to 120. Alright, Mr. Jones, I'm just going to be doing some suctioning now, okay? I'm going to expose 4 inches. Right, ready? Cough, cough. Alright, so I did the suctioning. I'm just going to put back the oxygen device. Alright, Mr. Jones, how is that? Was that okay? You're breathing a little better? Okay. Do you need me to do more suctioning? No? Okay. So if you do need more suctioning, I would have to wait at least 30 seconds before I could perform the next suctioning, okay? And then I'm just looking at your O2 set now. It's at 98% still, so that's good. So that means we don't have to do any hyperoxygenation at the moment, okay? Alright. Okay. So, just gonna do a glove change. Wash my hands for 20 seconds. Again, wash my hands for 20 seconds. Grab a new pair of gloves. Alright, Mr. Jones, I'm going to be changing your inner cannula now, okay? So I'm going to take out your oxygen device. Okay. Stabilize that. Dump that. Should only grab the wings. Stabilize that. So I hear a click, right? Hear a click. And then now I'm going to take out the dressing. Okay. Dump that. I'm going to do my skin assessment. I do see that there is no redness, no swelling, no sign of infection, no evidence for skin breakdown. So the site looks good. I'm going to stabilize the inner cannula. Okay, and then I also see that the device is intact. No cracks on the device, no cracks on the trach stabilizers as well. Okay, everything looks intact. So I'm going to put that back. Okay, do another glove change again. Wash my hands for 20 seconds. Gonna wash my hands for 20 seconds. I'm gonna grab the other pair of clean gloves. Alright, Mr. Jones, I'm going to be cleaning your site now, okay? Dip in a normal saline. Gonna clean under here. Okay. Dump that. And then I'm gonna actually start to stabilize the thing again. Go. Dip that in saline. Just swipe to the right. Dump that. Dip this into saline. And just clean under. Around the skin. Dump that. Dip this into saline. Dip around there. Dump that. Then dip this into saline. And just swipe around. Okay. Dump that. Now I'm gonna pet dry. Okay. Then dump that. Now I'm gonna put in a new dressing. Okay. Now I'm gonna put that back. Alright, how was that, Mr. Jones? Is that okay? You feeling any pain or discomfort? No? Okay, good. So, I'm just gonna be back in a few short moments. I'm actually gonna be grabbing a second nurse to change your trach stabilizers, okay? Alright, so I'll be back in a few. In the meantime, just gonna change 20 seconds. Throw away all the stuff I don't need. In the meantime, if you do need anything, here's a caller, okay? Just let me know if you need anything. In this part of the video, I'm going to be changing the trach stabilizers by myself. However, for the purposes of this video, I will be pretending to have a second nurse with me because I know that in reality, I would have to have a second nurse. All right. Okay, Mr. Jones, I got wash my hands for 20 seconds. My second nurse with me, so now I'm going to be changing your trach stabilizers, okay? All right. I'm going to take off your oxygen device first, okay? I'm going to grab my trach stabilizers. And the trash. Okay. All right, so let's begin now. Have my second nurse stabilize that for me. Okay. And then I'm going to do my skin assessment. I do see that there's no signs of infection, no redness, no swelling, no evidence of skin breakdown, so that's good. Okay. Alright, so I'm going to push this to the other side. Alright, Mr. Jones, my nurse and I are going to lift you up, okay? We're going to check your neck. So I do see that there's no evidence of skin breakdown, no signs of infection, no redness, no swelling. So everything looks good on the neck. Okay. And then the second nurse is gonna take that out. Hold down the faceplate. Okay. Throw that in the trash. Okay, and then my second nurse does see that there's no signs of infection, no redness, no swelling, and then no evidence of skin breakdown. So it's good on that side. Okay, so everything looks good now, so I'm gonna check the stabilizers. Okay, looks like I can fit 2 fingers, so it's secure. Just gonna flip this back. Okay, how's everything, Mr. Jones? Everything good? Good, no pain or discomfort, good. You're breathing a little easier? Good. Okay, so I'm just gonna check your vital signs now. Vital signs are stable, respiration rate at 16. O2 sat is at 99%, which is good. And then I see that there's no evidence of increased work of breathing, so it's good there. So I'm just gonna dump this. And then I'm also gonna actually clean your suction catheter as well. And of course some normal saline halfway. And I'm gonna clean your suction catheter that I used earlier. Okay, it's now clean. You can put that back at the head of the bed. Throw these away. And then I'm gonna wash my hands for 20 seconds. I'm just gonna take a listen to your lung sounds, okay? Breathe in, breathe in, breathe in, breathe in, breathe in, breathe in. Okay, everything sounds good. Okay. Now before I go, Mr. Jones, do you have any questions for me, concerns? No? Okay, good. So here's a call light. Just let me know if you need anything, okay? Don't hesitate to press it. Okay. So I'm gonna leave the room, 20 seconds. As I leave the room, I'm going to document the date and time, the patient's tolerance. I'm also going to be documenting the respiratory assessment, the vitals, O2 sat, the site assessment, and I'm going to document that the patient had clear, thick sputum, and it was around 40 milliliters.